Injections are a cornerstone of modern medicine. They deliver medication quickly and effectively. Healthcare professionals use various injection techniques. Each technique targets specific tissues. Mastering these techniques is crucial. Safe and effective medication administration depends on it. IM injections deliver medication into the muscle. Muscles have a rich blood supply. This allows for fast absorption. Common sites for IM injections include deltoid muscle, which is in the upper arm, used for vaccines and some medications. Vastus lateralis muscle, which is in the thigh, preferred site for infants and young children. Ventrogluteal muscle, which is in the hip, a safe and less painful site for adults. IM injections are used for various purposes. These purposes include vaccinations, pain relief, and antibiotics. The dosage and type of medication determine the injection site. SC injections deliver medication into the fatty tissue beneath the skin. Absorption is slower than IM injections. Common sites for SC injections include the abdomen, away from the navel, which provides easy access and good absorption. The outer thigh, another site for self-administration. The upper arm, specifically the back of the arm, used for some medications and insulin. SC injections are commonly used for insulin, blood thinners, and some vaccines. They are also suitable for patients who need frequent injections. IV injections deliver medication directly into the bloodstream. This allows for immediate effects. Trained healthcare professionals administer IV injections. Common sites for IV injections include veins in the hand, which are easily accessible, veins in the arm, specifically the antecubital fossa, which are larger veins for higher volumes. IV injections are used for a wide range of medical purposes. These include fluid replacement, medication administration, and blood transfusions. Intradermal injections deliver medication into the dermis. The dermis is the layer of skin just beneath the epidermis. Absorption is slow and localized. The most common site for intradermal injections is the inner forearm. Intradermal injections are primarily used for tuberculosis skin tests, to detect exposure to TB bacteria, and allergy skin tests to identify allergens. IO injections deliver medication directly into the bone marrow. This provides rapid access to the circulatory system. It is used in emergencies when IV access is difficult or impossible. The most common site for IO injections is the proximal tibia or shin bone. IO injections are used in critical situations such as cardiac arrest, to administer life-saving medications, severe dehydration to rapidly replenish fluids and electrolytes, and shock to improve blood circulation. Syringes are essential tools for injections. They consist of a barrel, plunger, and needle. Different types of syringes are available. Hypodermic syringes are the most common type and are available in various sizes. Insulin syringes are specifically designed for insulin administration and have smaller capacities and finer needles. Tuberculin syringes are used for intradermal injections such as TB skin tests and have a small capacity and a fine needle. The choice of syringe depends on the type of injection, medication dosage, and patient factors. Needles, gauges, and lengths. Needles are attached to syringes to deliver medication. They come in different gauges and lengths. Gauge refers to the needle's diameter. A higher gauge number indicates a thinner needle. Length is measured in inches or millimeters. The needle length depends on the injection type and the patient's size. Choosing the appropriate needle gauge and length is crucial for patient comfort and safety. Step-by-step injection procedure. Administering an injection involves several steps. First, preparation. Gather all necessary equipment, including the medication, syringe, needle, alcohol swabs, and gloves. Next, hand hygiene. Wash hands thoroughly with soap and water or use an alcohol-based hand sanitizer. Then medication preparation. Check the medication label, expiry date, and dosage. Draw up the correct amount of medication into the syringe. Site selection. Choose the appropriate injection site based on the type of injection and the patient's age and body mass. Site cleaning. Cleanse the injection site with an alcohol swab using a circular motion, moving from the center outward. Injection. Insert the needle into the skin at the correct angle and depth. Aspirate or pull back on the plunger to check for blood, except for intramuscular injections. Inject the medication slowly and steadily. Needle removal. Withdraw the needle quickly and apply gentle pressure to the injection site with a clean gauze pad. Finally, disposal. Dispose of the used needle and syringe immediately in a sharps container. Patient comfort and infection control. Patient comfort and infection control are paramount during injection administration. For patient comfort, use a septic technique, choose the appropriate needle size, and inject the medication slowly to minimize discomfort. For infection control, wear gloves, cleanse the injection site thoroughly, and dispose of sharps safely to prevent infections. By following these guidelines, healthcare professionals can ensure patient safety and well-being. Documentation and post-injection monitoring. Proper documentation and post-injection monitoring are essential. For documentation, record the date, time, medication name, dosage, route of administration, injection site, and any adverse reactions in the patient's medical record. For post-injection monitoring, observe the patient for any immediate reactions, such as allergic responses or bleeding. Provide instructions on potential side effects and when to seek medical attention. Accurate documentation and careful monitoring help track the patient's response to the medication and ensure timely interventions if needed.